In the United States, government documents show there is no way the lockdown is close to ending. Yesterday alone, nearly 1,900 people died. Tonight, there are more than 480,000 confirmed cases of COVID-19 in the U.S., and more than 18,000 people are dead. But as Jackson Proskow reports, the president insists the economy will be up and running by May.
In New York, there's no end to the sadness. Bodies are taken to temporary morgues outside hospitals that are filled to capacity after another day with an unthinkably high number of deaths and more mixed news.
To use an overused term, we are cautiously optimistic that we are slowing the infection rate. That's what the numbers say.
There were nearly 10,000 new cases reported in the state in 24 hours. But hospitalizations have leveled off, and for the first time in weeks, more people were discharged from the ICU than admitted to it.
It's really about the encouraging signs that we see, but as encouraging as they are, we have not reached the peak.
Across the U.S., there's still an alarming surge in case numbers in new hotspots. New Jersey and Pennsylvania are seeing their numbers rise dramatically, raising deep uncertainty about when life could return to normal in the U.S.
When we decide at a proper time when we're going to be relaxing some of the restrictions, there's no doubt you're going to see cases. I would be so surprised if we did not.
President Donald Trump has suggested he'd like the economy to restart by May. But U.S. government projections obtained by the New York Times suggest fatalities would spike if stay-at-home orders were lifted after just 30 days. There remains a shortage of COVID-19 testing needed to allow a return to regular life.
We are doing tremendous testing, but you'll know. You're going to know before anybody because you're going to see nobody's getting sick anymore. It will be gone, and it won't be that much longer.
That requires getting the crisis under control. In a sick twist of irony, some of America's private hospitals have started to lay off doctors and nurses in the middle of the pandemic, blaming losses suffered after elective surgeries were canceled to make room for coronavirus patients. Jackson Proskow, Global News, Washington.
Now, there are signs tonight that Italy and Spain have passed the peak of the pandemic, but it's a very different story in the UK and France, which are now witnessing their worst waves of COVID-19 since the virus hit. Redmond Shannon reports.
Politely policing a pandemic. A London officer asks people to go home if they are not visibly exercising. Enforcing the rules here is getting more difficult as the spring weather improves, even as the death toll soars.
Of those who've contracted the virus, 8,958 have sadly died, an increase of 980 since yesterday.
In Ireland, the national lockdown has been extended until May 5th, and police are out to block any Easter getaway plans.
I can reiterate, a journey to a holiday home is not an essential journey. We will be able to turn you back.
Police in France are using humour to convince people to stay home. The message: the couch should be as far as you go this weekend. In Germany, the death rate among those infected is distinctly lower than in other parts of Europe. This group of worshippers gathered for a special drive-in Good Friday Mass, praying for the victims and their families. And in the Vatican, a Good Friday Mass like no other. Pope Francis addressing an almost empty St. Peter's Basilica. Italy remains the country worst affected by the pandemic. This year, only the Pope was permitted to kiss the crucifix. A solemn moment and another reminder of how this crisis has touched almost every aspect of life. Redmond Shannon, Global News, London.
As we keep you informed about COVID-19, Donna Friesen will be hosting a special program on Sunday evenings. It's called Coronavirus, the New Reality, and it starts this Sunday at 7 p.m.